thank you so much for joining us. Again, my name is Robert K. Elder. I am the president of the Chicago Headline Club, and I'm the chief digital officer for the Bulletin of the Atomic Scientists. Welcome to the Chicago Headlines Club's conference on how to more safely report on the coronavirus and COVID-19 pandemic. So today we are joined by three illustrious guests. I will start with Dr. Shelly Flais, who's a pediatrician and a mom to four. She's written parenting books with the American Academy of Pediatrics, and her practice, Pediatric Health Associates, is based in Naperville. She's also an assistant professor of pediatrics at Northwestern University's Feinberg School of Medicine. We also have Christine Wolfram-Taylor, Chrissy. She's the managing editor of the Chicago Tribune, and she sort of drives the staff in daily coverage there. She's responsible for setting the strategic agenda for audience growth and for technology definition and other responsibilities across the newsroom. Finally, we have Dr. Robert L. Murphy. He is the executive director of the Institute for Global Health, as well as the director of the Center for Global Communicable Diseases and the John Philip Phair Professor for Infectious Diseases at Northwestern University, Feinberg School of Medicine. Wow, that's a lot. So, why don't we start this out actually in the newsroom? So, Chrissy, can you share with us what you're telling your reporters to do, and if they have any special kits or directions, what are they doing out there, and how are you keeping them safe?
Well, it's tricky, and I think that, we haven't always done the best right off the bat. I think we all kind of stumbled into it. We had some PPE on hand, but definitely not enough to protect the entire newsroom. So when we first started off, we really had to narrow the focus onto the highest risk assignments and make sure that those who were going out them were, first of all, comfortable to take those assignments and understood the risk within those and feel comfortable having a conversation about their comfort level. And if they are not comfortable, to let me or Colin know and their editor, and we'll figure out another way to handle that assignment. But since we've been at this for a couple of weeks now, we've started to ramp up our PPE kits. And a kit to start off with was an N95 mask, gloves, hand sanitizer or wipes if we had them. Now our kits we're starting to build for the entire newsroom that's still out reporting, surgical masks, boots for their shoes, gloves, goggles where we have them, hand sanitizer, wipes as we get them available. We're just kind of constantly seeking out materials, but also wanting to be conscious that there are other people like the healthcare workers who need them more than we do. So as we're triaging that, we're making sure that we are keeping what we need and sharing what we don't with the healthcare organizations around us.
Mm-hmm. And how has that sort of evolved? I mean, I watched WPTW last night, and I watched, Paris Schutz interview somebody like 10 feet away as his cameraman panned, and I'm watching, like Monica Ang at WBEZ create a boom mic out of a broom handle. So what are you seeing, and what are you specifically telling people?
So I remember when this first started, before it had really picked up here, we did a story on a couple that were self-quarantining. They had just gotten back from a cruise ship, and we did the interview through the window. We took photographs on the lawn and shot into the house with them in the window. We really tried to maintain distance. I think, we are trying to educate our staff through training when they're getting PPE to understand how to handle certain situations. Again, I think we can do a better job of that without question as the guidelines continue to shift, making sure that our reporters and photographers in the field have the most up-to-date information so that they can mitigate their own risk when they're on assignment. But, we're telling them to maintain social distance. I'm instructing editors to make sure they're having conversations with reporters if they're going out on assignment to talk through what does that look like and how can they protect themselves and their subjects in those situations. And we're really encouraging wherever possible to do those interviews remotely over the phone. I mean, we've got the benefit of not necessarily needing to shoot it from a video camera standpoint, so we can conduct a lot of our interviews remotely. But there are those situations where we do need to put reporters and photographers out into the field. And again, it's a conversation. And we've been encouraging reporters to let me know if they have any situation where they don't want to go out on assignment. And so we can talk through that and not send them.
Mm-hmm. That's great. That's great. So let's move to Dr. Flais again. So Dr. Flais, your expertise is, pediatrics. And so how do we protect ourselves? We have reporters or photographers who are out working in the public. When they come home, what should they do to protect their children or elderly relatives? What are the guidelines? What do you suggest?
Well, and you've hit the nail on the head. We're not operating in a bubble, whether we're journalists covering a story, healthcare workers, we all have families that we come home to. And so that's a huge area of concern for us. And that's part of why the theme of us being in this together we can protect each other and reduce, with social distancing and the measures that we're taking, reduce the spread of the virus and reduce the impact and avoid overloading the healthcare system. In terms of social distancing, the good news when it comes to kids, because as a pediatrician, I'm an advocate for children as well as families, parents, and healthcare workers. My perspective is what can we do to protect the greater population? When we look at the data, kids are relatively spared, which is unusual because usually with respiratory infectious viruses, influenza, for example, the young and the old are targeted. The CDC looked at 150 cases in the US from February 12th till April 2nd. Even though kids younger than 18 years of age are 22% of the population, only less than 2% were positive for COVID. Keep in mind, any numbers that we talk about are underrepresenting because the US is still ramping up testing. We do not yet have universal testing, so we always have to keep this in context. Also, every death is a tragedy, and knowing that behind this data, behind these numbers are actual people, actual loved ones. So in terms of washing hands, the 6 feet apart, the new CDC recommendation is to use, for the general public, to use homemade or cloth masks. This is a change. Initially, the concern was the healthcare workers wouldn't have enough. So I have visual aids here. I have a regular surgical mask that I brought home from my practice, which is different from N95. This is still in plastic because it's basically gold at this point. I brought a paper bag because healthcare workers are in the position of reusing their personal protective equipment, which puts them at greater risk. But with the supply lines being cut short, that is a difficult situation and we're left with no choice. For the rest of the community, if you have to go out for the grocery store, for example, to wear a homemade or cloth mask, the CDC website actually has instructions for that. That does not take the place of social distancing though. Staying at home is the best way to save lives. And just like you said, in terms of journalists and media coverage, whatever you can do remotely via phone, text, video conferencing is beneficial.
Mm-hmm. And so I want to get into some nitty gritty, and that is, like for example, my sister works at a veterans hospital, and my mom is older, and so when my sister comes home, she literally undresses in the garage. Is that being too cautious? I mean, what should people do working in risky environments?
Absolutely. Operate under the assumption that everything is covered in COVID. And coronavirus, COVID-19, it goes by many different names. Mm-hmm. I don't like syllables, so I'm just going to call it COVID for the rest of our conversation. Assume that when you're shopping, it's on the can of soup you're looking at. Assume that it's on you when you come home. Shoes. I'm a big advocate for not wearing shoes in the home anyway. Definitely leave your shoes in the garage. If you have an entryway, perfect. A lot of my medical friends strip down in the garage, yell to their family that they're home, run to the laundry room, put their dirty clothes in a garbage bag in the garage, go immediately in the hot shower. It is not wrong to be cautious about this. Healthcare workers are at great risk, and if you as a journalist are in the public eye and interacting with the public, you have to assume that you're at greater risk.
Mm-hmm. And what about, this was from one of our participants, what about cleaning and reusing masks? What are the guidelines there? I know it's not ideal, but do you have any advice?
Well, that's why I showed the paper bag. Plastic bags, for example, like a Ziploc bag, would theoretically retain the virus longer. So if possible, store it in a paper bag. Some hospitals do have the ability to sanitize and reuse N95s. Not ideal, but under the circumstances, it's what's necessary. A lot of healthcare workers are using the same N95, 95 being that it filters 95% of the particles, for a week. Again, not ideal, but that is unfortunately what we're up against. And I would strongly advocate that if anybody has extra supplies, there's #GetMePPE Chicago, which is a local effort. There's a lot of national and local efforts to collect extra PPE to divert to our ICUs and ERs, those who most need them. So that would be, I think I would be in favor of a journalist reusing and being cautious, so that the resources can get where they're best needed. There are some great online videos where Tupperware can be used to reuse an N95, minimizing, because the problem with any mask is that you're touching your face more. And I've seen people in the grocery store bring their mask down, bring it up. Well, anything that was on your neck is now on your face. So the whole don't touch your face, it's really hard with masks. But with the Tupperware technique, you can it's usually like about this big, you bring it to your face, you take the elastic on the Tupperware, remove it, put the lid on it. You need holes in it so it can breathe. And then when you're ready to reuse it, take the lid off, put it back to your face, and the elastic around your head. And then that way, you're reusing an N95, for example, without touching it excessively. And we're doing our best.
That is the best DIY Darth Vader. So that's pretty amazing.
Agreed.
Desperate times.
Well, and so what are we seeing people do wrong? And this is for Chrissy and Dr. Flais as well. And because again, I'm at the Bulletin of the Atomic Scientists, and whenever we see photos of politicians with masks but no gloves, it's like, what are you doing? So what are we doing wrong?
Well, I can speak to gloves right away because I've seen their misuse everywhere. People think that if you have gloves on, you can just touch everything. No, you're basically spreading the virus. So you have to be just as cautious. I'm concerned that gloves offer a false sense of security because it doesn't replace hand washing, either with soap and water for 20 seconds, singing happy birthday twice, or hand sanitizer containing at least 60% alcohol. I've seen too many people grab their phone, grab their car keys, reach in their bag, pull out the wallet to pay for groceries. All they're doing is transferring, and then at the end of the trip, you throw out the gloves, okay, but then it's on all your inanimate objects. So you do have to assume if you would use that approach, you still have to be as cautious of everything that you're touching. I'm also concerned because in communities, a lot of parking lots are now filled with gloves in the parking lot.
Yeah.
And essential workers are tasked with cleaning up our gloves, and that's terrible.
Yeah, I'm seeing more masks and more gloves just on my street here in Oak Park. It's strange. Can we talk a little bit about pets? There's some interesting information out there about felines can get COVID, but can they transfer it? Do we have any more research on that?
Coronavirus COVID is transferred human to human contact. Those stories break my heart whenever I hear about a tiger at a zoo, celebrities, professional athletes getting tested. My big question is, what about the healthcare workers on the front lines? Because God forbid we as physicians are seeing patients with being an asymptomatic carrier, meaning we have the virus, but we're not showing signs of it. And that's one of the points I wanted to make about COVID's contagiousness. It is more contagious than influenza. If you have influenza and you're in contact with, you can contaminate 1.2 other people. COVID is more than that. It is 2 to 2.5 other people, as compared to measles, which one case can infect 9 other people. But it's a little bit apples and oranges too, because if you say, well, COVID's only a little bit more contagious than influenza, the issue is influenza, we have broad testing. It is everywhere in the US, it's readily accessible. All I do as a pediatrician in January and February is test kids for influenza. So that's readily available. So we know what we're dealing with. With COVID, we don't yet have widespread testing. We don't know where it is. The other tricky thing about COVID compared to influenza is with influenza, you are most contagious when you're showing the signs of illness. Those 3 days that you're showing the runny nose, cough, fever, that's when you're most contagious. COVID is different because you may not show symptoms for 5-7 days, yet you're transmitting the virus to other people. And then the other hugest problem is that there's no vaccine, unlike the influenza seasonal vaccine that we have each year. So in terms of pet to human, I would love Dr. Murphy's take on this if he's able to join us. But my big focus as a physician is the human to human transmission, hence the need for social distancing, washing hands, washing surfaces.
Yeah, there's been some interesting reporting out there. I'm not sure anybody knows, but how many of us are touching a tiger? Like, that's the other thing. Like, the closest I'm getting is Tiger King on Netflix. So, let me see here. So we just had someone join us. Is that Dr. Murphy? No? He's trying to call in. So I have a few other questions here, and we have about half the time left. So a lot of people, including myself, we're taking this time to sort of clean our homes, and for journalists, like cleaning our equipment. So let's go back to Chrissy. What are you telling your reporters on how to clean their iPhones, their equipment? What's the guidance there?
So our photo director, Todd, has been working directly with his staff on equipment cleaning for their cameras and things like that, and making sure that gear is getting cleaned. All the photographers use most of their own gear, and any gear that's being exchanged in the newsroom is cleaned after use. As far as guidance to the newsroom on cleaning the phones, now that you mention it, I'm thinking, like, I'm taking notes as Dr. Shelly is talking, because I'm getting a lot of good information, taking on the mask and stuff like that. I think that's where we could do better in educating everyone to make sure that they are following all of these best practices. You hope common sense prevails as everybody's being told to social distance and clean their phones, and we're reporting on these things. You're hoping that everybody's doing it, but I'm sitting here taking good notes on things that we should make sure people are doing. To make sure everybody's following those best practices, like cleaning their phone after every time they go out.
Yeah, no, I keep, what is it, The New Girl, that sitcom, one of the characters calls his iPhone the germ brick. So, Dr. Flais, can you talk about how to clean equipment?
I call my iPhone a fomite box, fomite being the fancy word for the germs just sitting on your things. And I have to say, as a pediatrician, we deal with so much infectious disease that I live a life even before the pandemic of assuming every surface has been vomited on. So in terms of using a public bathroom, no way am I touching the faucet. You wash with soap and water, you use the disposable towel to turn off the water, use the towel to open the door to leave the restroom. Those sorts of things are good practice anytime, pandemic or not. So Rob, what was your question?
It was just how to.
I went off on fomites.
Yeah. But it's just how to.
Oh, yeah.
Well, and literally, do you take a Lysol disinfectant wipe? Like, what's the process?
I'm actually a cancer mom. My daughter's in remission. I have 4 teenagers. Luckily, she's, thank God, doing great. The day that the WHO declared a global pandemic was the day she rang the end of chemo bell at Lurie Children's. So we're very fortunate. So we already had 1 million Clorox disinfecting wipes in the house because of having a compromised immune system and life with cancer. So I do keep a personal baggie with me with wipes ready to go. So I shopped for my older parents yesterday, and at regular intervals, I was wiping down my phone, my keys, anything that I was touching regularly. Cashiers are asking us to pay with credit cards, not money, because money's very dirty. And I don't have one of those fancy UV light boxes. Some non-medical people have these in their homes where you put your phone in there and the UV light disinfects it. but I'm old school and I just wipe it down, and I don't know, my iPhone cover's kind of loved anyway. So yeah.
So at my house, we actually have a weird little ritual. It's actually a chore now, and somebody goes around with a Lysol disinfectant and they clean all of the light switch plates and all of the handles. So we had one of our participants in this meeting just ask about cleaning homes. You know, what should we be doing? What should we be paying attention to? So either of our guests, please weigh in on that.
Yeah, the frequently touched surfaces. So sink faucets, the flusher for the toilet, light switches, door handles. I love that you guys made it part of your family routine. I think if you, not everyone has the Clorox wipes because of hoarding, unfortunately. So if you have them, keep them out and visible as a visual reminder for everyone to, okay, I'm going to prepare lunch. The biggest things are washing hands before preparing food, washing like the kitchen island, for example, if you're going to prepare lunch on it. I think that having things visually there is a good reminder for everybody.
And so I'm told we have Dr. Murphy. Dr. Murphy, are you there?
Yes, can you hear me?
Yes, we can. Thank you so much for joining us.
Sorry, I'm having a little technical trouble here. I don't know what happened, but I'm unable to connect by the Zoom with the passwords and stuff. I'm very sorry.
No. Thank you so much for joining us. And so we've gone over some of the broad strokes, you know, cleaning our equipment, cleaning our homes. We had a question because this seems to be, there's a lot of misinformation, and then there's some testing about pets. Felines can have it, but you know, there's one tiger, and how many of us are touching tigers? I'm just wondering if you have any guidance for dealing with pets during the pandemic.
Well, the CDC has guidance, and there are some data. The tiger, as you mentioned, is the only one that's been cultured, except for a dog in Germany, I think. You know, we know that this virus came from animals, and there's no reason why it can't go back and forth between animals and humans. We don't ever test animals, so we don't really know if it's with the animals. However, we don't think that the animals are a major source, just epidemiologically looking at animals. I mean, just the people with animals versus those that don't have animals, the spread in the same household, approximately the same. So it's probably not a big issue.
And I wanted to give you the opportunity here just to talk about your experience. You know, what are you seeing in your workplace? You missed our introduction, so I wanted to give you just a little bit of space to talk about that, and then to give some general advice.
Yeah, okay, thank you. So I'm Rob Murphy. I'm professor of infectious diseases here at Northwestern, and I'm executive director of the Institute for Global Health. I'm primarily working internationally. But my original focus was with HIV, but I also worked during the Ebola epidemic in Mali, which was one of the minor Ebola sites, and I was the scientific administrator of the lab there that was actually testing for Ebola. So I'm familiar with the HIV epidemic, the Ebola epidemic, and now I'm following the coronavirus epidemic, primarily from the international aspect, but of course I'm here in Chicago. So I'm part of that. So we recently did an analysis here at Northwestern looking at the new Abbott test for the 5-minute test and how it compared to our standard assays and the Cepheid one. So I'm familiar with that, and I'm of course following everything very closely here, mostly on a policy level.
So we have a couple of questions coming in via email and via the chat. And so I'm just going to open this up to any of our panelists. And that is for people who suspect they had COVID and recovered without incident. Is there a way they can help?
Is there a way they can help? Is that what you said?
Yeah, like should they be donating antibodies or blood, or like, is there a way they can help people who think that they have overcome this?
Yeah, they definitely can help. And they're setting up protocols here and many places around the country actually looking at giving the serum from those patients from the persons to actual patients. So there's a treatment approach. But the other approach is that perhaps these patients are really immune and they're not going to get it again. We know with SARS that the antibody protection lasts for several years, maybe as many as 8 years. With the regular coronaviruses that are causing the common colds, it may not last quite as long. But at least it's working most likely, right after you get it, within the year or two after you get it, most likely. And that's why 54 companies are trying to make a vaccine to make the same type of antibody. So it's definitely, those people can be very useful.
Mm-hmm, mm-hmm. And we have a couple of other questions coming in here. So I'm going to mispronounce your name. Is it Raza? Is that right? There you are. So I'm unmuting you. Do you want to ask your questions?
Yeah, can you hear me?
We can.
Okay,
Yeah.
So my question was, I represent the union that represents television photographers, and we've been doing sort of pool camera coverage. In the news today, it was announced that Tony Preckwinkle is going into self-isolation due to having exposure to someone on our security task force who tested positive. I'm wondering, I'm going to be getting a phone call, I'm sure, from our pool camera people who were covering her events. What's the level of concern they should have? What precautions should they be taking at this point? What do I tell them?
How close did you get, or did they get?
I'm going to be taking a guess. From her, we were 9 feet, but there's always people milling around, and I don't know who was her security task force, for instance, or anything to that effect. But I'd say 9 feet from her on these press conferences.
How long was the conference for?
These press conferences typically go about 45 minutes.
Oh, okay. So that's a potential significant exposure. The exposures are kind of broken down less than 2 minutes, 2 to 30 minutes, and greater than 30 minutes. So there's a potential exposure there.
Okay.
What should they do, Doc?
Well, there's guidance here. For, no mask, but a potential exposure, you just become aware of what, just if anything happens, you go immediately get tested. You don't have to go into quarantine. It has to be a bigger exposure than what he's described. A known person, someone in the household, something like that.
Mm-hmm. Dr. Flais?
And I would just add, moving forward, to make sure we're following the CDC recommendation for using facial coverings, not only in an effort to protect yourself, but the part of why the CDC has changed their recommendations that the general public wear it is to reduce the spread from us to others, assuming that we already are asymptomatic carriers, to reduce the spread to others. So moving forward.
That's a really good point, because everybody around in that press conference should have been wearing a mask except for the person speaking. Mm-hmm. And that's not happening.
And Raza, is that how you say your name?
That's correct. You nailed it.
Yeah. So you have a second question about windscreens and microphones.
Secondly, with our not pool camera coverage, but we've been putting a mic stand with microphones 6 feet away, and people can come and talk into that. But my concern then is what's proper cleaning for that? And secondarily, there's windscreens on those, which are kind of a spongy, porous material. Are those kind of traps for viruses, germs? Should those be excluded altogether? I'm just wondering what precautions we should be giving for microphones when they're closer to the person.
This actually comes up quite a bit. If you've got the metal microphone, you can just wash it down with an alcohol wipe. It's got 60% alcohol. But the sponge ones, they're more difficult to disinfect. I don't even know how you would disinfect that.
Okay.
Yeah. Chrissy has the Tribune photographers. Do you have any experience or guidance in this?
Not with microphones. We haven't really used any that I know of. All our video has been drone video that I can think of.
Okay, no, that's great. That's great.
So I would think the microphones would be really bad because singing we know is a very high risk, and of course speaking right into a microphone, you are as you speak, droplets can come out of your mouth. That's a potential source.
Yeah. We have a few more minutes. So Amanda had a question in the chat, and Amanda, I'm going to unmute you and ask you to state your question.
Hi, I just had a question about pediatric therapies, given the human-to-human transmission that we talked about. If pet therapy could be an alternative option. A lot of kids respond well to it that have different diagnoses on autism scale and things like that. If they can't get therapy that they're usually getting in school. And I don't know what kind of medical recommendations we could be giving because a lot of those places are closed right now. At least it would be something for them, given what we know.
Yeah, in general, I can speak to that as a pediatrician. The American Academy of Pediatrics is very concerned about access to care. Specifically, babies younger than 2 years of age, we consider the wellness checks to be essential visits. Not only we're tracking growth, development, screening for diseases, most importantly, they're getting vaccines. Measles, pertussis, we cannot have a measles outbreak on top of a COVID outbreak. And it's interesting to live in this day and age. Vaccines are the greatest public health advancement of the 20th century, and we're now seeing what it's like to live in a society lacking one vaccine. But that said, in terms of access and therapies, we as a pediatric office are large enough. We have different locations, so we've designated healthy and sick locations. I know that a lot of therapies for mental health have moved to a telehealth model. We as a pediatric practice are now supplementing with video visits. Early intervention, which is Illinois' burst to 3 years of age, child and family connections, it's also known as for occupational therapy, speech therapy. They are currently working on telehealth visits. So I would recommend telehealth as much as possible. Pet therapy is awesome. My only concern, and I think that's a fantastic idea, and things like a pandemic mean you have to think outside of the box, but rounding up the resources, pulling it together. Although I gotta say, as pediatric offices, we have pulled things together in a matter of a week or two. So depending on this hammer and dance that we're doing with the pandemic, we might be getting creative and figuring things out. But I think that's an excellent idea.
Yeah. So we have just 5 minutes left. So if you have not asked a question, please do so in the chat box, and then I'll unmute you. If you can't figure out how to do that, you can also email me. I've emailed everyone here personally already. Let me see. We actually have one from Megan. Megan, let me see if I can find you here. I cannot, so I will ask your question. Let me see here. Oh, that's more of a policy thing. So let me sort of paraphrase. So how are you seeing, and this is for everyone, how are we seeing businesses deal with people taking sick leave versus vacation? How is that affecting business, and what do you recommend? Definitely they should not go to work, but anyone jump in, please.
Our small business, essentially our private practice is a small business. We are absolutely following. There's new legislation on this being announced every day. Up until now, it was FMLA, Family Medical Leave Act. But we are very prepared for, especially as healthcare workers, we have contingency plans upon contingency plans, assuming that our staff needs to quarantine for 14 days. In terms of leaves of absence, we have had, again, just to circle back to our original conversation, we don't live in a bubble, and a lot of us have family members who are immunocompromised or take care of elderly parents. And so we have had individuals who have had to make adjustments for that. There's actually an email in my inbox, what the current federal law is for our employees to be able to protect themselves and maintain income given the pandemic and situation. So it's a moving target. It continues to evolve daily.
Mm-hmm, mm-hmm. Anybody want to chat?
Yeah, I'll jump in here too, because I know there's been a lot of chatter about our policy. You know, it's under review, and newsroom leadership's working with the company as the doctor just alluded to. The federal regulations of this are changing on a daily basis, but it's our goal to make sure that our employees are paid. You know, we have a short-term disability leave that gives 4 weeks at 100%. So, you know, and then there's some discussion over the flexible time off that employees are given right now at the corporate level. So our first priority is the health and well-being of our employees. And so that's what Colin and I are pushing for in those conversations as the legislation continues to evolve.
That's great. Thank you so much.
Mm-hmm.
And there are no other questions coming in, but I just want to ask a general question. So after we have bathed in Purell and worn masks and gone jogging in a forest reserve, what else can we do as journalists, and especially journalists out there taking photos and mingling with the public? What can we do to take care of ourselves holistically? Because there are only so many seasons of Ozark on Netflix. You know, what can we be doing?
Plan on what you're going to do as soon as they lift these restrictions. That's what you should do.
So say that again.
Life is going to go back to normal, and it's going to go back to normal in steps. You're going to be able to go out, go on the metro and stuff like that, you know. But they're going to. I bet it's going to be can't be in groups more than 10, then 25. You know, it'll be some kind of graduated return to normal to see if they have the. If there's a blip in the number of cases.
Chrissy,
and
Dr. Flais?
I would just say that we should all be kind to ourselves as adults. Pediatrician here, I'm always speaking in kids versus adults, but there's no rule book for this, especially if we're suddenly working from home, yet we have school-age kids who are doing their e-learning from home. Coordinating everything is a lot, and just be kind to yourself and know that, you know, take each day as it comes. Each day may not be perfect, but we're work in progress. As a pediatrician, I'm concerned because research shows when families are stressed, kids are at increased risk of being abused. And so I would advise adults and parents to take their own pulse first and think about, is this going to be a problem tomorrow or next week, or do I need to give myself a timeout? Especially with, we always talk about giving little kids timeouts. Sometimes we adults need timeouts. And so if you need a timeout, recognize that and go ahead and do it.
Okay. And Chrissy Taylor from the Tribune, any thoughts?
Yeah, I mean, I think I echo what the doctors just said. I'm finding it hard for myself to take that time out. It feels like there's just the constant barrage of news 24/7. And so I'm always trying to remind managers in the news meetings and anyone I come in contact with to just, the first question is, how are you doing? How are you holding up? Are you taking care of yourself? Are you taking time away to disconnect, unplug, stop looking at your phone, stop reading the news, just kind of take that mental well-being to step away from this, because and I said this very early on, like, this is a marathon and we are in like the first 10th of the mile. And so nobody should run into this. Like the first week, I remember the story ideas were just flying from everywhere and everybody had something they wanted to do. And I just kept telling everybody, there's going to be time for these stories and we need to make sure that we take care of ourselves. I will say, like, I learned a lot going through the Sandy Hook shooting in Connecticut when I was at the Hartford Courant before I came to Chicago. And, you know, you really do, it's important for managers and leaders in newsrooms during these kind of crazy times where the instinct of a journalist kicks in to tell the story and to not stop, that we leaders have to be the ones that make sure people take that time to stop and take time for themselves and not burn out. Mental health is just as important as anything else.
All right. So we're a little bit over time, but I think that is a wonderful place to leave it. Thanks to all of our panelists for all of their advice and recommendations. And I know that seeing myself on camera made me realize how much I touched my face without even realizing it. But we're going to have more of these video conferences in the future. That said, again, thank you everybody for attending. And if you have any follow-up questions, we will try to address them outside this time. So thank you again, and everybody have a safe, lovely day.
You too.
You too.
Bye-bye.